So today I'm going to be talking about one of the common tests that we use in, well, a whole of medicine. It's called a full blood count or a complete blood count, often shortened to FBC and CBC. This is one of those bloods that we sometimes call routine bloods, although I don't really like the term because there's nothing routine about having your blood taken. But it's a very straightforward test to perform and can get you results pretty quickly. Like any blood sample, it's obtained by putting a needle into the vein, and in most centres, it'll be attached to a tube like this. For the complete blood count, you usually will find it's a purple top tube. Now, it might be hard to see, even if I put this close to the camera, but this tube has got a chemical on the inside of the tube called EDTA. So this is sometimes called an EDTA tube. That chemical binds the calcium in the blood, and that prevents the blood from clotting so that it can remain liquid for analysis in the lab. Now, actually, to perform a full blood count, you don't really need very much at all. Just a few drops at the bottom of the tube is usually enough to perform this test. If you're doing other tests, one of the tests that we like to do with a EDTA tube in rheumatology is called the ESR test, the erythrocyte sedimentation test. That requires you to go right to the top of the tube because the dilution of EDTA makes a difference. So what happens when this tube goes down to the lab? Well, that single drop can be put into the analyzer and a laser beam is shot through the blood, and how the laser beam light scatters can actually tell us about the type of makeup of your blood, which I find quite fascinating. So the scatter pattern is interpreted, and different scatter patterns will be picked up to tell us information about the three main cell types. So there are three types of cells in blood. There are the red cells, erythrocytes. These carry the oxygen and take away the carbon dioxide. You have the white cells, which are our immune cells. And the third type of cell is the platelet cell, which is involved in clotting. Now, there's a lot of different bits that come through the interpretation, and I'll try and give some details and put up a little chart about the reference ranges. Each lab will have its own reference range, but I'm giving an example of them in some images that will come up. So let's start with red cells. The first number you could look at is the absolute red cell number. To be perfectly honest, that's not one I often look at. My focus tends to be going straight to hemoglobin. Now, red cell number will obviously work out how many red cells there are as an estimation. The hemoglobin is the contents within the red cell that allows us to carry the gases, carry the oxygen and carbon dioxide. And it's usually measured in grams per unit of volume, so litre or deciliter. If that is low, then typically we would term that as anemia. You do need to be a bit careful. Some people will have very low hemoglobins for reasons that I won't go into in this video. So anemia isn't just about the number of hemoglobin grams per litre, but also about how it affects the individual, because people can sometimes survive on much lower levels in some situations. But certainly if it's dropped, you're concerned that you don't have enough red cell production, and that could lead to fatigue and tiredness and breathlessness. It could be a genetic reason that you have problems with your red cell production as well. Now, you can actually get high levels of hemoglobin in some situations. That could be a production problem, that's quite rare. But if you're a smoker, your body may try to compensate by increasing hemoglobin, and other reasons can cause it. For example, if you live at altitude or you're using anabolic steroids like testosterone, this can rise the level. So if we're looking at the hemoglobin, it's low, we then might want to understand about some sub-analysis. Again, these aren't quite so commonly used. Hematocrit, which is in effect the proportion of red cells compared to the other cells. So if you have less hemoglobin, you may see low hematocrit because the red cell proportion is less. You could look at mean cell hemoglobin. So if each cell has less hemoglobin, that can be found in some types of anemia. Again, less important than the absolute hemoglobin number in most situations. But what is important is something called the MCV. That stands for mean cell volume. So the red cells have a usual size, and if the size is particularly large or particularly low, that might give you a clue as to why your hemoglobin is low. So if you have very, very small red cells, that might be a sign you're losing or have lost iron or are iron deficient. There are some other conditions that you may have been born with, like thalassemia, where you may get very small red cells being produced. But if your red cells are very large, then that could be a sign of other deficiencies. For example, it could be that you have folic acid deficiency or vitamin B12 deficiency. The one issue with that is what happens if you have both iron deficiency and you have B12 deficiency? What if you've got really small cells and really large cells? Well, you can do the distribution width, and that will tell you that although the average cell size is normal, it's a very, very broad width, and that means you probably have some small cells and some large cells. That's only really used by the lab technicians because then they might want to actually look at your blood under a film to understand why there's such a different variety of shapes, and there may be some other problems going on there. So that's how we look at your red cells. Then we have the white cell numbers. Now, there will be a range again. Some people will naturally be a little bit above the range or just below the range, and that doesn't necessarily mean they have a problem. Just like some people are naturally taller than others or shorter than others without it being a medical problem. There's the overall number of white cells, and then we break that down into different subtypes. The most important subtype, I would argue, is neutrophils. These are your frontline cells. So if your neutrophil count is significantly lowered, that can be a problem. We monitor neutrophils particularly when we give medications that can suppress the immune system, and we get nervous when the levels drop. Typically, numbers of 1.5 or below or less than 1, the units I'll give in a table on this video, that's where rheumatologists might get a bit nervous about neutropenia, low neutrophil count, and maybe giving you a phone call to see if you're feeling all right. The other type of main type of cells, another kind of frontline cell, is lymphocytes, and often this may be involved in viral infections, and it may dip in viral infections, but you may also see dips in lymphocyte counts in some of the autoimmune conditions we treat, like lupus, which can cause cell counts to dip. One of the final ones of interest to rheumatologists is the eosinophils. Now, these are a specialized cell. They're normally involved in parasites and worm infections, which in much of the Western world we don't see much of, and that has been a hypothesis as to why we might have more things like asthma and allergy, because they can become excessively reactive. One of the conditions that rheumatologists deal with is hypereosinophilic problems, high levels of eosinophils, particularly a condition called EGPA, which is a form of vasculitis. I won't go into more detail, but certainly a very high eosinophil count is a relatively uncommon finding. We also have basophils and monocytes. You can see these go high in some rarer conditions, perhaps glandular fever, maybe some things like tuberculosis. In most situations, we don't look into those in great detail, but if you had an exceptionally high level of one type of cell, like an exceptionally high lymphocyte count or exceptionally high basophil count, you may need to have a blood film, because a huge production of one cell type could indicate something a little bit more serious, for example, a leukemia. So finally, then, we look at platelet count. Platelets are these very small cells and they aggregate together. They form a kind of net, and that helps with clotting formation. So when the clotting cascade starts, they join together, they web together, they capture within that web all the other types of cells, which basically plugs any holes in the vessels or forms a scab to prevent more blood loss. You can see high levels also found in inflammatory conditions, so inflammatory conditions of the bowel, but you may also see high levels of inflammation in conditions of rheumatic cause, so inflammatory rheumatological conditions. But the levels can go low as well, and they can be low because of an autoimmune attack. So the platelet levels may be removed by the immune system, and one of the conditions being idiopathic thrombocytopenic purpura, ITP, which means we don't know the cause. You're getting low platelet count, and you're getting a rash that's a non-blanching rash because the low platelets are stopping you from effectively preventing the blood loss. So you might get little areas of blood loss through the capillaries of the skin, giving this characteristic rash. So, full blood count, complete blood count, really quick test to do, doesn't require much blood, and really useful test to do. We look at red cell numbers, we look at white cell numbers, and we look at platelet numbers. And it can give us clues as to your overall health, whether you likely have deficiencies in things like iron, B vitamins, whether there may be evidence of inflammation from high levels of cell counts or autoimmune disease because the levels are very low and are being reduced. It helps us monitor our medications effectively and gives us clues into some clotting issues, for example, with platelets. I hope you found this explanation helpful and have a better understanding now of what those values mean. And if you do find these videos helpful, I'd love to hear what your thoughts are below, or give the video a like or a share so that it can help the visibility for the channel. Thank you.